Okay, this is the audience. Hello, my name is Zoe Haynes, and this is my managerial communications for COM 3300. The topic that I will be discussing today is communications issues that arise in healthcare situations. Communication is key throughout all healthcare experiences. Initially, doctors need patients to communicate their symptoms in order to properly diagnose their illness. This initial assessment sets the tone for the treatment process. The risk report will focus on the following areas: the types of communication within patient care, why proper and adequate communication is necessary, and the issues that arise and how they can be resolved. First, we will examine the types of communication. First type of level of interaction is patient-doctor. This is the interaction that you will encounter as a patient. The questions of how are you feeling, what brings you in today. Those are the questions and interactions between you and your doctor. Doctor-nurse is the second level of interaction. This is the communication that takes place out behind the scenes when you are not present. This is how your doctor communicates your care plan to additional healthcare providers, mainly nurses, as to how you will be treated. The final level of communication is doctor-administrator. This is a level that is hardly ever witnessed by patients. This is where the doctors communicate to hospital administrators and staff what needs to be done. It's a more business formal side of the communication experience. But mainly on this presentation, we'll focus on the patient-doctor and doctor-nurse levels of communication. Although there are different types of communication within the healthcare setting, we'll focus on the patient-doctor. Communication between these two individuals is very important because it affects the overall patient care experience. Research found that an estimated 1/3 of chronically ill adults misuse their prescription due to fear of cost. If this were communicated to the doctor in appropriate times, doctors can employ the doctor administrative channel to see if there are other opportunities for patients to receive their medicine at lower cost or for free. This is done by research by Pete Heiser Wagner in 2004. Furthermore, it has been shown that patients that have effective communications with their doctors increase their likelihood of adhering to prescribed care plan and lower their risk of return and repeat appearances in the hospital, according to a study done on preventive care by Safran, Rogers, and Ware in 1998. Now we will address the issues that arise in healthcare. As you can see on the slides, this has a diagram of the issues that can arise at any single level of communication. Poor provider-patient communication has a poor understanding of the disease and the patient's behalf and the risk and treatments. Poor patient healthcare system has poor access and misuse, as we discussed earlier. Patient interacting with the healthcare is poor information, knowledge of the drug skills, and the insurance coverage for different procedures. These all have an effect on the patient's welfare, the doctor's frustration or satisfaction with their job, and they're very important and should be followed too. As these problems have been presented, of course, the best thing to provide is also solutions. From my understanding, I think there should be a three-tier approach to the solutions to these problems, starting with culture, education, and direct interaction. So let's stop from the top down. They're kind of chronological. The education will take a little bit longer. The culture will take a longer. The education is a bit more time. Direct interaction is the immediate result that we can see today. Since the early 1800s, the doctor has always been the dominant commanding force in the patient care experience. In recent years, with creation of things like My Care Plan or the Affordable Health Care Act, the control has shifted over from doctors more into the patient's hands. So with that being said, the culture of the medical community is changing. So doctors are taking a step back and more likely to engage with their patients on the communication of what's going on, how can I prescribe you a care plan that fits into your lifestyle, your needs, and your needs. The doctor is no longer going to say, okay, you need to eat 5 meals a day, and they all need to consist of this amount of protein and this amount of that, when it's a person who works a full-time job and they barely have time for 3 meals a day. So if they are able to communicate and change the culture that it's a working relationship between the two individuals, it'll change the care conditions. According to the Aspen Institute, who did a research on how the cultural level change works, culture change is a difficult undertaking in a system where professional values are integrated into an organization over time. Yet such change is possible, even on a large scale. The Cleveland Clinic is progressively reorganizing its multiple healthcare systems and 3,000 individual physicians into a new structure, according to Kennedy and Payne. If the Cleveland Clinic can reorganize their staff, anyone can. The next level is education. Now that medical schools are switching over to a more humanities-based approach, it will provide better doctors who are better equipped to communicate with their patients outside of just the scientific problems of what's going on. They'll be able to communicate, hey, I know maybe you don't understand what cancer is, but they can now convey it to you because they have a broader understanding and a broader application of, this is how I talk to someone who hasn't had microbiology and chemistry and organic chemistry, so that educational change is helping direct that. The next level is the direct interaction. I interviewed 2 different nurses and they said that this is the most important level of communication, to make sure that direct interaction with patients, that doctors and patients are actually communicating with each other, to make sure that the patients are saying what they need to say to the doctors and the doctors are saying what they need to say to the patients. Both Nurse Sue and Nurse Ann said that times and times again, they encounter patients who are more willing to give them more information than they are to the doctors because they're more comfortable. So that direct interaction wall needs to be broken so that this channel can be opened up so they can say, hey, this is what's wrong, because a detail that may not be important to them is important to their healthcare provider in diagnosing them. In closing, it is apparent that there are several issues within the healthcare system, communication problems. They're present, but as examined and shown, these issues can be addressed and resolved. So, and I think overall will improve the healthcare experience. Now, would anyone have any questions?
What can patients do to improve their communication with their providers?
The biggest thing that patients can do to improve their communication with the provider is to communicate. Very often, patients leave out critical information from when they're communicating with their doctors because they don't think it's relevant. So it's always good to have an open approach and address everything. Tell them all your concerns, all of your symptoms, all of your needs, so that they can make a proper diagnosis.
Why is communication in healthcare field so important?
It's extremely important because if doctors aren't communicating with patients, how will they know what's going on? How will you know that, okay, I have a headache, but if you also say, I'm not saying, if you just say I have a headache and you don't tell your doctor, I also have a leg ache, they're not going to know, and that's going to hinder them and hinder their ability to treat you properly. All right, so.
Thank you.